there was a time where it went well, actually. There was, when we pulled up, we came for a CHF patient, and there was a doctor in the room when we got there. We were able to go right in, and there was a doctor. She was doing treatments. I think she was giving a nebulizer, and the whole time there was conversation, and like there was a team atmosphere. She even knew kind of what to expect from me, what kind of medications I had. We talked about giving morphine, whether she would give it or whether I would give it, and we discussed the dosing. And so there was a whole team atmosphere. There was a lot of people in the room. They were all helping, and we were able to get the patient, who was pretty sick, stabilized and transported pretty quickly, which was awesome.
Well, in general, skilled nursing facilities would ask for an EMS provider to come to the facility when they need one of their nursing home residents transported to an acute hospital care setting, usually for an emergency evaluation. For each facility, the reason that they send somebody might be a little different. In general, a lot of facilities have a variety of medications available. Some facilities even have, IV therapies available. But it's not necessarily universal what each facility has. And so the availability of those resources certainly influences what residents go with emergency medicine providers to different sites of care. One of the things that often influences the transfer of residents or the involvement of EMS providers is nursing home staffing. I think there's generally some large misconceptions about staffing that's available at nursing homes. This is another thing that's widely variable. But a lot of nursing facilities have one registered nurse on site at a time, if any. And that registered nurse may not adequately be able to meet all of the assessment and treatment needs of a resident who's acutely ill. And this can sometimes influence the need to call an EMS provider for some help.
There's several. When you get there, finding the patient, sometimes you go in and nobody knows that an ambulance has been called. Nobody knows where the patient is. Nobody knows who you're looking for. Oh, let me go get the nurse. And it takes 5 minutes to find the patient that you came lights and sirens for. That can be pretty frustrating. And sometimes you can find the patient, but nobody knows anything about them. Like the staff that are there aren't sure of the medical history, aren't sure why the nurse called, or the nurse isn't there. I mean, and we have to wait to get the story on the patient. So that can be frustrating because oftentimes you aren't able to communicate very effectively with skilled nursing facility patients by, maybe it's hard of hearing, or whether it's the severity of their illness, or either way, we expect to get some sort of like report from the staff, and sometimes that's hard to come by. I think also the patients, they tend to be pretty sick, and it's really difficult to communicate with some of them. Oftentimes you don't expect, I guess, to be able to communicate very well with them. And then other times when let's say we've got the patient loaded and they're ready to go, and if they're critical, we have to wait for the chart to be copied or something. That's frustrating because, if it's an emergency, if it was emergent enough to call an ambulance, and then we have to wait for the chart to get copied before we can go to the hospital, that can be pretty frustrating. So I think in general, when they're not ready for us is a source of frustration for EMS.
So I think one of the biggest sources of conflict is what people's priorities are, and that gets reflected out in the communication. EMS is involved in or interested in ABCs, primary survey, secondary survey, address the critical issues that are present currently. On the nursing home side, their familiarity and their focus is traditionally much more on functional status, cognitive status, and things like that. And so there is a little bit of a communication gap, and there's a little bit of a priority gap that has to get resolved by close working together between the two groups. I think another challenge potentially is that the nurse taking care of the patient may not know the patient very well, and in most skilled nursing facilities may be covering a large number of patients. And so when EMS goes in and wants to know all this information, the nurse may not know, which would result in the EMT or the paramedic getting angry or frustrated with this nursing home staff, which really isn't fair. Nursing staff has to rotate. You can't have the same nurse there 24/7, and that's going to result in some challenges in terms of knowledge of that patient. I think some of it is also just kind of a approach to the patients. When EMS comes in, we tend to be very matter of fact, move quickly, let's get going. While that is our standard, that may not come off that great to somebody else. And so there could also be some interpersonal conflicts because of just the nature of the people that go into EMS and the nature of the people that go into other fields.